You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey Vet Rehabbers, today Narda Robinson from Curacao joins me to chat about veterinary botanicals. I find this topic really interesting and one that we all get exposed to. We've all had that client that comes up with a list that their pet is on a whole lot of supplements and herbs. So it's really important we educate ourselves about these herbs so we can prevent any interactions with anything we may prescribe. And of course, if some of these herbs can be beneficial to our patients, we can recommend them. Before we head over to the interview, I want to let you know about our veterinary communities on Facebook. They are the Small Animal Vet Rehabbers, Hydro Vet Rehabbers, Equine Vet Rehabbers, and our Business Vet Rehabbers. And you guessed it, that's where all our vet rehabbers hang out online. They share research, tips, and advice, and it's really a great supportive community, and we'd love to have you online there with us. The links are all in the description to the podcast. And also now a quick word from our sponsors. Hero Braces is devoted to helping canines lead an active lifestyle by specializing in custom braces for stifle, hock, and koppel injuries. The reality is that not all dogs are able to have surgery, and custom bracing can be a great alternative that provides stability and allows dogs to remain active. Since Hero Braces are custom made to every dog, maximum support and comfort with reduced fitting complications is achieved. You can learn more at gohero.com. All right, you ready to learn more about botanicals? Hey, Vet Rehabbers, thank you so much for joining us. Narda, thank you. Lovely to have you online with me.
Happy to be here.
Narda started Curacao, which is basically an online and in-person courses for medical professionals as well as veterinarians. And one of the courses is actually on botanicals. So that's why we're here today, because I think it's quite appropriate for us vet rehabbers. We have a lot of clients that often will use different types of botanicals, and maybe they source them themselves. These things are not always that safe, and so Narda's going to be just going through all of that with us and just teaching us how we can find ways in which we can use these botanicals in our practices in a safe way. And we also want to chat about how they can interact potentially with other drugs that we might use. So I'm really excited, Narda, to talk about this topic. Before we start, though, I'd really love it if you could just introduce yourself and just tell the listeners sort of how you got into the field and where your interest for botanicals came from.
Yeah, well, I've always been interested in natural medicine, and that's why I went through the osteopathic medicine pathway, which in the U.S., our license is the same as allopath, so MDs and DOs, because we learn medicine in surgery and all the other things, but also have an orientation about promoting healing from within, activating the intrinsic mechanisms by which we restore homeostasis. I mean, if you think about it, how intricate it must be for us to maintain a relatively stable body temperature and heart rate and all these things. So we have just built-in principles within our body to move towards health, but sometimes those get impeded, and that's why it's good to know how to remove those impediments, whether it's through acupuncture, manual therapy, or medications, or I guess in last-ditch effort, surgery as appropriate. But botanicals have always interested me. I grew up near a forest and would go in there and look at the plants and everything. And so I thought that it was just a great area of study to learn about. And so when I graduated from medical school and postgraduate training and had my own practice, I was performing medical acupuncture. And most of my physician colleagues would also use Chinese herbs. And I did for a while, and it was fun because the names of the mixtures would have just terms of the sage or the quietude or just wisdom or things like that. And yet I'd look at the bottle and there were about 10 or 12 herbs that I hadn't had training on specifically, but you go to these courses and they're like, yeah, there's these contents and they remove liver wind or support kidney yin or activate kidney yang. And I just thought, what am I doing here? Because this isn't pharmacology. But the standard of practice within Chinese herbs is to look at the tongue and the color and the cracks and dryness and this and that, and you feel the pulse. And then just as we've spoken before, with my transformation into, well, what's really going on with acupuncture? The same is true with traditional Chinese medicine and herbs. And I don't feel comfortable prescribing herbs to any patient of mine, human or animal, because when I don't know what's the principle, what's the mechanism of action, what are the risks, what are the interactions with medications or with other herbs, what are the contraindications, what's the dose, all those things. And so after medical school, when I went to veterinary school and graduated and had started the medical acupuncture program at Colorado State University, where I taught for 20 years, I just looked around and at what was veterinary holistic medicine, as it was called 25 years ago. And now it's more integrative, but it was the same thing. Look at the tongue, feel the pulse, even though these practices weren't validated for even the human for whom they were designed. And now we're extrapolating them to animals. And even more so, I was resolute that I didn't want to cause anybody harm or death. And I felt that it was important that if I was going to use herbs, that I know what's in them. And so no secret ingredients, no secret quantities of ingredients. That's just not ethical in my way of thinking. And I need to know how they worked. So I don't know, probably 10 to 15 years ago, we had created an herb course. I actually taught the same herb course at Colorado State when I was there. And mostly Western herbs, but some Chinese herbs, about those that we knew how they acted relatively and what are the red flags and so on. Then came cannabis, and that was at about 2015. And I eventually left CSU after 20-something years to just focus on my continuing ed with veterinarians and physicians and all that. But cannabis has revised botanical medicine, as far as I'm concerned, because even though it came from this like illegal kind of background for most of the 20th century, now that there's so much effort on research, on like the certificates of analysis, so finding out if it's not fraudulent, but having a lab analyze exactly what's in it, what are the ratios, what's the batch-to-batch variability, what are the pharmacokinetics, pharmacodynamics, drug interactions, bioavailability issues, how do they react with dogs versus cats versus horses. That has, to me, reset the standards for what good botanical medicine is. And I think that the rest of the field needs to follow this with transparency and concerted efforts at research. So that's where, we can talk about a lot of the other botanicals as well, because herbs aren't just cannabis, because that's kind of consumed a lot of people's minds. But any plant drug should be regarded as a drug, and we should know the pharmacology, et cetera. It's the research for non-humans is less, but just looking into the literature, I mean, the past 3 years or so, there have been a number of impressive studies coming out. Things like curcumin, which is a derivative of turmeric, and boswellia, which is from the frankincense tree. Unfortunately, that's going extinct. And ginger, just different things. So it's very promising. And when we look at it in the full range, this is a long answer to your question, but in the full spectrum of things, I think that people have, well, if they're not like, well, if it's natural, it must be safe. Then there's the other end. Well, we don't have enough knowledge. We could hurt somebody, whatever. I think that is not a level playing field, because there are so many medications that we routinely have been taught to give to animals, and their side effect profile is much more daunting when you look at it. And how many of us can really fully delineate what all the potential adverse effects are of that medication and the interactions and so on. So I think that it's just, we don't want to go in the woo-woo direction, but there's much more that we could be doing for animals with botanicals than is currently happening. But more education needs to get into veterinary schools, and we need continued research on these products.
Yeah, thanks, Nada, for the introduction. And yeah, I'm looking forward to chatting more about this topic. Nada, I mean, one of the things with these botanicals is, as you've mentioned, is the safety of them. And as a vet myself, I'm always concerned as to the interactions they potentially can have with one another. So if you're using more than one botanical, and then the interactions that they could have with any allopathic medicines that we're potentially using. And I think as for vet rehab therapists, especially in recommending these type of herbs and things, we need to be very aware that sometimes owners are not 100% sure of exactly what medications that they're giving. So they might come to you on a referral basis and, in their notes, everything might not be there. Like what you think the animal is getting and what the animal's actually getting is sometimes different. Many times I've had where I've actually 100% thought this is what, because the owners told me what's been in the notes from the vet. Then I found out, no, actually the one day they went to another vet that was down the road, and then you didn't get the history from that vet, and that vet prescribed some other non-steroidal, and then they were giving 2 non-steroidals because they didn't understand that. I didn't know that because I only got the history and what they told me. And so these kind of things are potential problems that can arise when we are suggesting, especially using herbs. So can we start off with just chatting about the safety in general of herbs? I mean, how safe are they? Is it something that we should be recommending? And, what are the things that we should be concerned about?
Good question. So are they safe? We don't fully know because there's not been enough research on many of them. On some of them, there has been, some research and enough that some people are doing reviews of the research. So something like turmeric is reasonable, but only about 3% of turmeric root is curcumin. So it's just important to know, again, like to have a pharmacological understanding of what these are and what the risks are. So there could be intrinsic toxicity. So, for example, you can go into a pet store here in Fort Collins, Colorado, and buy anti-flea products that may have pennyroyal in them. So it's a plant. It's from the mint family. In historic times, people might give a little bit of pennyroyal to a baby if they had a lot of cramping in their intestine. Well, pennyroyal is a highly toxic mint plant and can cause hemorrhage and liver failure. And there's actually a case report in the Journal of the American Medical Association in like 92 or something of a dog just getting bathed when they used essential oils externally with pennyroyal to control fleas. And the dog started seizing. The mother took the dog to the vet, just had all this hemorrhage and lung problems and liver failure and died in 2 or 3 days. Uncontrollable, just problems. So it's a really toxic herb, but in the same family as, I brought some catnip here, as the mint family. So there are safer mints and non-safer mints, but even people have died from pennyroyal. So that's intrinsic toxicity. And so that's important to know. And even so, some of the Chinese herbs that I had mentioned before, if they have secret quantities of things, and if they have, let's say some have herbal strychnine in it, obviously a neurotoxin. So when we go into the woo and say, oh, well, this one dispels spleen damp and all this stuff, if you don't really know what that product is, then you could be committed, it's an error of commission. And so when it gets to things like that, if an animal got in trouble, got sick, and you're not monitoring every 6 weeks or so as you first get started for changes in like platelets or the liver values and things like that, if it came down to it, one might ask, are you practicing within the standards of care for your area? So that's a potential liability. Again, why we can't just be piling these products on willy-nilly, but you have to, I always think, especially coming from human medicine where there's a lot more lawsuits and things, I always think, okay, if I do such and such, can I defend that scientifically, medically, ethically, in a court of law even? So I want to be really sure. And just to myself, I would feel so bad if I hurt anybody. So that's kind of my guiding principle there. And then there's interactions. For example, St. John's wort is the poster child of an herb that will interact with other herbs or drugs. So at CSU, I'd be consulted for maybe patients that had cancer coming for chemo or radiation. And the client might say to the student, can you just give this to my dog who suffers a lot from separation anxiety? And I got this at the pet store. It's St. John's wort. Give that. And so what are the ramifications of that? If that student doesn't know, doesn't report it, whatever, the potential is for St. John's wort to negate the effects of the anesthesia, of pain medicine, of chemotherapy, of other drugs, because of the way that it increases the amount of enzymes in the liver that kind of gobble up and destroy medications and other drugs. So it's going to change the blood values of other drugs. Not that St. John's wort doesn't have inherent health benefits in certain instances, but I mean, another example, it's kind of relevant to the US right now, is for women of childbearing age who are on oral contraceptives and take St. John's wort for mood or depression or whatever. That's a real risk that pharmacists are educated to tell people walking in the store. Like if you come up to the counter, it's like, I want my prescription and here's a bottle of St. John's wort. They should be telling them, do you realize you can't take those together because you will inactivate that medication and you could end up pregnant? So big time issues that we need to know about. Then, of course, with any of them, because at least in the US, they aren't well regulated, they aren't FDA approved, then there could be any number of things. There could be the dose that's listed, there could be higher, there could be lower, there could be contaminants, adulterants. There, a lot of the Chinese herbs over time have been found to have undisclosed pharmaceuticals in them. So you're stepping out into a very uncertain area when you're practicing herbal medicine for animals. And if you accept that and you have knowledge about it, then that's one thing. If you're going out, well, my friend said that she gives her patients this, that, and the other, then I think that's not good medical care.
Yeah. So, I mean, what are the safe ones that we could use then? So what are the safer ones? Can you give us a few that potentially we would be able to use? And I mean, my first thought is ones that help with inflammation, so anti-inflammatory herbs.
So yes, and they're not going to be safe for everybody. And that's where, like for our herb course, I do recommend people get an app, like it's called About Herbs app. It's free for download, and it's from the Memorial Sloan Kettering Cancer Center. And the National Institutes of Health has one too, but I like the About Herbs app because even for the relatively safe ones that we can talk about, there will be contraindications for any of them. And so certain animals shouldn't get them. And again, we don't really know what the dose range is that we should do. But our anti-inflammatory herbs, big salient ones, I mean, of course, CBD has become very popular, but turmeric or curcumin, which is the active constituent, the main one there. And so you'll see that, and boswellia, which I mentioned, and that's from the oleoresin gum from the frankincense tree. But yeah, again, unfortunately, it's a very endangered right now. And then ginger. So many of these have a wide range of effects. So ginger is great also as an antiemetic because some of the ways it works relate to the brainstem, where that's our kind of nausea center, and it has anti-pain effects. So many of the plants that are out there will have like antioxidant effects. This isn't because the plant said, well, someday a human or an animal might eat me, and so I want to do good for them, and I'm going to make some antioxidant compounds. It's just that these plants produce these chemicals in order to protect themselves from excessive sunlight, from excessive stress, from whatever. And it's just that however evolution at all came about, we often have similar receptors and are similarly benefited in ways like antioxidant potential from the plant's own, defensive compounds. But more and more what's being found is that the herbs that are anti-inflammatory, like boswellia, like turmeric, like ginger, and even with CBD to an extent, and black pepper, which we usually use in concert with turmeric, that they inhibit some of the COX enzymes, the cyclooxygenase enzymes that will produce pro-inflammatory compounds, the lipoxygenase enzymes, so inhibiting those pro-inflammatory prostaglandins, et cetera, and as the antioxidant effects that I mentioned. So all those things are not only anti-inflammatory for just our joints as we think about, but they're also neuroprotective. So the nervous system is so central to what we do with rehabilitation and pain control. And there's also effects on the vanilloid receptors. So you might think the TRPV1, so those are analgesic, and regulation or modulation of the transcription at the nucleus of the nuclear factor kappa B, which is part of the engine that will also produce these pro-inflammatory like cytokines and things. So it's multifaceted the way that, these select groups, I mean, as we have on the page, I'm just looking over here at the page, like yucca root also, comfrey has anti-inflammatory aspects, but it's also highly toxic. So yes, yes. And so this is my black and white one, but good. Yes. And so there I have it that the top is safer and the bottom is less safe. And so, but there's overlapping actions with a lot of them. But with the knowledge of the pharmacology, we could better tailor how we're going to recommend things if we recommend them based on what the animal needs.
And for those of you that are interested in getting this, you can go to the website that I've just put there. Curacao has kindly made this available to us. So you can just download it, and it's really cool, a little sort of table saying which are the most safer and the less safe ones and the benefits and problems with them. So thanks so much for that, Narda.
Oh, sure.
So where would we source these herbs now? Like, most of them, a lot of them come from China. So in order for us to make sure that we've got safe herbs, if we want to use them, where would you recommend that we get them from?
Well, yeah, it probably varies with each country and everything. But I think that if we were going to look at turmeric, for example, I would prefer that somebody get them from a company that has already filtered out any heavy metals. And it would be more effective to have the curcumin like that was extracted and maybe any of the other relevant chemicals and combined. So rather than just shaving turmeric or sprinkling some turmeric spice on the dog's food every day, then it's much more effective to go with the active constituents. So then we get into, okay, well, what companies are reliable? And I mean, there's a handful in the US that have risen to prominence. The issue with any of them still is that these are not FDA approved compounds. And as we've seen with human herbs, that even some of your standard mainstream lines have been shown to have herbal substitutions and problems with quality control. That said, people look online, there's free for download. There's a study, I have it in my pile over here, but it's on curcuvet and in combining that with boswellia. So some of the companies, just like with cannabis, will have papers done by people that did research on their products that demonstrate that that was an effective thing. So that's where I would look probably for curcuvet. And, but again, I think the availability is going to vary across countries. But the other thing is, so if we stick with turmeric, for example, or even cannabidiol, but some of these are poorly bioavailable. And so like with something like golden paste that people will see, that's a mixture of turmeric and some kind of oil mixture usually, and maybe black pepper, and you'll see all kinds of different recipes for that. Well, the black pepper is there because there was a study on humans that showed if you just even have a little bit of that black pepper, that's going to really boost like 2,000% or something the activity of the curcumin because it inhibits some of the degrading enzymes there. So that's important. And then having some kind of an oil base, whether it's a lipophilic kind of shell, something that gets that product absorbed is important to have as well. So that's where, if we want medicinal effects from these plant drugs, I think that getting to a supplement that has, just one or two things in there and that in your country that veterinarians have been using fairly reliably? Because unfortunately, we still have to have this kind of trust or faith in the manufacturer because it's not regulated. So we have quality control issues, but certainly some companies will be better than others. So is that kind of answering your question? Oh,
Yeah.
Wait, let me just say one more thing, that the issue with turmeric or any of these other root products, so even ginger, but turmeric is so well known for having heavy metal toxicity or heavy metal contamination, whether it's because, again, maybe in Asia or maybe somewhere else, that turmeric grew in the ground from, like, maybe it was next to a paint factory that was putting out cadmium. So these are plants that take up what's in the soil and they can concentrate it. So if it's not there, maybe it's in the processing. Maybe there's fake yellow applied. So it might be a fake in some way. So that's more things to question.
And what is the most common way in which we can give these herbs? I mean, a lot of them are made into liquids. Like if I think about a lot of the CBD oils, they're mixed with oil and made into liquid. The golden paste is made into a paste. I mean, is it something that you can ever sprinkle over the food? Do animals eat them? Can you share with us a little bit more about that?
Yeah, well, it's going to vary again with each product, but that's again where if you want a fairly reliable amount of active constituents, then something that's in a capsule that, if there's problems with uptake, has the appropriate structure around the product for absorption, then that would be the most reliable way. There is a study out of Colorado State University on cannabidiol that showed among different preparations that the oil extract was the best taken up. So that's a big contrast to, let's say, little biscuits that have these things in it. And I'm familiar with sending, CBD containing biscuits to labs, but anything else where you think, okay, you have a little biscuit. Well, where is the active constituent in that biscuit? How shelf stable is it? How did the baking and cooking affect it? So many questions there. And even the FDA has examined some of these products. It's been a while now, and found there wasn't really anything in there that looked like CBD. So it's expensive dog biscuits. So that's where, if we have a fairly reliable company in our area, and especially somebody that has gotten some research done on their products and can vouch for what's in it and is disclosing it, not having secrets, that's probably the best way. Yes, we could shave some ginger or whatever on the food. Some dogs will eat it, some dogs won't. But I think it's a good thing for food manufacturers to include also, and more are doing that. But they might say they have blueberries on the label. Okay, so like how many and what are you trying to do with that? They might say they have rosemary on the product as an antioxidant. Okay, well, but where are we with the therapeutic levels? So some of it's just advertising hype. But I think that food products could be made so much more interesting, palatable, and inherently digestible and good for the digestion. If you had something like ginger and turmeric in there, ginger especially is so good for the regulation of GI motility, and it has antimicrobial effects in the gut. I mean, so we could be doing so much better by just starting out with a lot of herbal knowledge and using that instead of just this old drug formulation kind of idea. Like, here, eat some food that's been overbaked and then take a drug to deal with the side effects.
Narda, so what are the most common drug interactions? Like if I'm thinking about the cases that we're seeing in the rehab world, mainly animals that are on anti-inflammatories and painkillers, what are the most common interactions which we could expect, and what should we be concerned about? So if we have dogs on non-steroidals, which are the herbs that we would, be very, very careful with using, for example?
Yeah, well, it's not completely clear about anti-inflammatory, like contraindication. If you have an anti-inflammatory herb, is that or is it not really contraindicated to combine with an NSAID drug? Because the pathways aren't really necessarily overlapping that much because of all the multiple mechanisms there. It might be that you could add in some curcumin and boswellia in there and then be starting to back off of the anti-inflammatory drug, which would be the ideal thing. There was a study in humans with moderate degree osteoarthritis of the knee, and they either got a curcumin mixture with some black pepper and different things, or naproxen sodium, and the effects were equal. So there's a lot of potential there that we can anticipate. But just like with anti-seizure medications and starting herbs or acupuncture or whatever, that I think you introduce it slowly. I mean, it's not going to be like giving 2 pharmaceutical anti-inflammatories at the same time. Mm-hmm. And then some of them, like there was one paper about devil's claw, and which has anti-inflammatory activities, and showing that was actually also renoprotective. So I think that even though we focus on inflammation for the control of pain, there are so many aspects to our rehab patients that are experiencing pain, a lot of which is myofascial. And so if we have acupuncture, massage, laser, and certain therapeutic exercises to deal with that myofascial dysfunction, that can help the nervous system calm down, wind down, so less sympathetic overdrive, and sympathetic overdrive is pro-inflammatory. So we can endogenously help reduce inflammation and not just rely on those NSAID drugs. So I think it would be a process, and just keeping in tune with the client who's watching the animal or seeing them back in and saying, how are things going? And it could be amazing how they don't need as much or any of that drug anymore, and they're just coming back to life. And that makes us happy because we are better healers and have more fun doing what we're doing.
Narda, do you have any experience, or had the unfortunate experience, should I say, of having a patient that has had an adverse reaction to a herb that it was being used by the pet owner? So the pet owner found something and decided to give it, and it ended up with an adverse reaction?
Well, not as much personally, but when I'm thinking of back when I was consulting a lot for the oncology center at CSU, I remember a cat being given quite a bit of garlic. I mean, who had a toxicosis there. Of course, there's CBD, there's hemp products with too much THC. But I think back to a little bit on the drug interactions, I would see maybe once or twice a year a patient that had lymphoma that was in remission because of chemotherapy. And then that client went to see an herbalist or a veterinarian or whatever, who was espousing the notion that if it's cancer, we can cure that with herbs by giving lots of immune boosting stuff, echinacea and medicinal mushrooms and all these things that can have immune boosting properties. But in lymphoma, that's a cancer, a neoplasia of the immune system. So to be packing that on, and of course, usually it's a bunch in a bag, those animals, that's what I would see. These animals would come out of remission from their lymphoma. So that's an adverse reaction. And after everything that the person who might have flown in from California or wherever, after everything they've done, they've put the animal through all the thousands of dollars to do all that, to have that reversed by some safe anti-cancer herbs, I mean, that's devastating. So, and that's where, again, with the St. John's wort, I mean, that kind of thing could happen, like really unpredictable outcomes. The other thing, and so it hasn't happened to me. I mean, I'm super careful, whenever I do it. But the other big thing to watch out for with things like ginseng, ginkgo, garlic, and ginger even. So even though ginger is great, it has anti-platelet activity. So those are the 4 G's: ginger, ginseng, ginkgo, and garlic. And especially if you have maybe Chinese herbs that it's like, oh, secret amount of ginseng and ginger because it's an ancient secret of the master. Like, you can't predict what the bleeding potential would be. And so another like, surprise, is that this animal oozes after surgery, the bleeding is uncontrolled, disasters could result there. And that's a big focus in human anesthesiology, like where they want to scrutinize any anticoagulant herbs and usually tell you to stop them and everything 2 weeks before.
Yeah. Yeah, I think that's something that maybe we don't, as vets, often say to pet owners. We don't even consider saying it because we don't think that they're taking or they're giving it to their pets. And Curacor is our gold sponsor at our Vet Rehab Summit. For those of you that know, our Vet Rehab Summit is our online veterinary rehabilitation conference. This is our 6th year that we're doing it now. So we're honored to have Curacor as our gold sponsor. And Narda, I just want to say thank you so much for coming online today. Is there anything else you think we haven't covered, Narda, that you wanted to share?
Yeah, well, I think along those lines, and what I designed this handout for was that people could have it just posted in the clinic as a reminder, but there's a whole bunch of herbs that could be on there. But I think that this kind of scientifically based, evidentially informed approach within integrative medicine is something that would be a great area for veterinary technicians to come into and be appointed or just serve as the liaison between the client and the clinic in terms of consulting about herbs and other things. And it's not that they would be prescribing them or diagnosing animals and saying, well, they need this or that. But with the time that it can take and just the interest, I think, within the veterinary technician community of offering some of these integrative therapies that, when supervised by a veterinarian, could be helpful and then safe and all that. I think that this is a place that veterinary technicians could just feel happier about what they do and continue learning and growing within their profession and seeing all the possibilities. And then also informing the rest of the practice, hey, guys, did you think about this for these certain cases? Maybe we should, as a group, look into this and start to study this more and offer certain things to patients. And I mean, a pretty safe way to do it is to go with a single herb from again, fairly reputable manufacturer. That's one of the issues, but we can be transparent about that and see how they do. Start for a few weeks, get them back in the clinic, do some blood work, and just start to become familiar with how this all works. And I think that clients would be super appreciative, whether it's a veterinary technician or the veterinarians. They want somebody to talk to. And unfortunately, like with cannabidiol or any kind of cannabis, if you don't have a medical provider that can talk to you intelligently and from an informed standpoint about the pros and cons and all these other considerations of these plant drugs, then what do? You go to the pet store and you have somebody that really knows nothing, maybe, or much less than we all should, guiding them and say, here, try this. Or at the dispensary, oh yeah, this, that, and the other, and yeah, your dog should take this. That would be not as ideal as if vet schools were teaching this and vet tech schools were adopting it, and that it be a seamless integration as more and more information becomes available into our day-to-day practice.
Yeah, I mean, you're so right. I mean, we don't learn anything about this at all at vet school. I mean, I know that I certainly didn't. I know that it's sort of something that's newer. But the good thing is that you have some online courses on it. So if you guys go to curacor.org, you can go into the veterinary professionals side. There is actually a course on botanicals. There is another course on cannabis too. It's really good to get that knowledge that you can actually advise your clients correctly. I can really see the benefit of that.
Yeah.
About those courses, Narda.
Yeah, when you go to curacor.org, because there's a med side, which is the human side. So go to the vet side, click on that, and then under courses and then botanicals, there's the veterinary botanical course, which is, we want to be clear that this is a certification, but it's not a license to practice veterinary herbal medicine. You have to be licensed or credentialed within your area, but it is a certification that you are a veterinary botanical medicine consultant. We want to be clear too that we're not training herbalists, because to be an herbalist, the idea that a lot of people come in with, which is what we disabuse them of as much as we can with the information that we present prior to registration. But the idea, the wish is that, oh, I could have a pharmacy filled with herbal products and replace so many of my drugs. Well, no, just everything that I've been saying, you might just want to start with one or two and see how it goes. And remember, can I defend this in court? Know the research. And that's where, yes, so this course, it's what, 15 or 17 modules. And the way I instruct, so it's all online, but I present, factual information, critical thinking, and we have assessments. And then, so there's multiple choice, but there's also free text. So that's where I might dialogue with somebody back and forth. And so if you choose to do if you choose to recommend herbs, that you do so knowing, like pretty much as I've said it, yes, you could use curcumin or, a mint or boswellia or ginger, but make sure you've gone to your About Herbs app. And even though that's human oriented, for the most part, that's what we start with. But you should know how to look up what is the latest research, because it's always going to be changing. So veterinary technicians can register for that, and veterinarians, and I forget how many hours it is. It's a very intensive course, though. And if you successfully complete that, then where I expect you to be is to have a discerning attitude, that even if something has an imprimatur of, oh, it's blah, blah, blah certified herb. Well, what does that really mean? That's maybe an industry group that wants to sell a product or something. So it's a level of critical thinking that some people are actually uncomfortable with, because they just say, just tell me the dose and where to buy it and I'm good. And that is not this course.
Right. Also, I think that sort of answers Lillian's question. So she's asking, is there any specific continuing educations for botanicals for certain cases, such as different cancers? She's working with the geriatric that has a whole lot of conditions, and she wants to know potential drug interactions. So would your course be something that she would be able to do?
Well, you could do it, but it's not going to get you where you want, because we wouldn't be teaching how to treat cancer per se with herbs. Yes, certain herbs have anti-cancer activity, but if there were herbs that could reliably cure cancer, we'd probably know about it by now. So I wouldn't be advocating for that. And mast cell tumor or whatever, that's a very tricky area to go. And so there could be other courses that might teach that, but I can't reliably or legitimately defend teaching anything about treating cancer. What we talk about is how to support patients that have cancer, but still, are they getting chemo? Are they getting radiation? Want to be very, very careful with that.
Yeah, I think Lillian said she's not curative, supportive. So I think she was on the same track as you.
Yeah. Oh, yeah, and that's great. Yes, I mean, like ginger has anti-emetic activities, so it could be supportive. I mean, I think just go to the website and look at the course and look at what we're presenting. I think that if we're thinking about supporting patients with cancer, I mean, probably the CBD would come up. We have a module within botanical course on cannabis, but then I have a whole botanical course, and we do address some of the cancer things. So there's stuff to do, but the way that acupuncture and massage can help animals with cancer, and then you don't have that pharmacologic issue, that would be my number one preference. And then probably adding in an herb or two with full disclosure with the client. Here's what we know, here's what we don't know, and going like that. So it has potential, but there's a lot of disappointment because there are nearly zero reliable doses, or that have been like researched. And even with CBD, those are certain companies, because every formulation is different. They have different strengths of each of the ingredients. They have different kind of manufacturing quality. So you have to be comfortable with some degree of ambiguity.
Awesome, Narda. Thank you so much. Lillian, thank you for the question.
Yes, thank you.
It's been wonderful chatting to you. Thank you for sharing all your knowledge. Yeah, and I'm looking forward to learning more about botanicals, and I'm going to study this little download that you've given.
That
So
sounds
for
great.
those that haven't got it already, you can go to curacle.org/vet/10 botanicals/. So thank you once again, Narda, and yeah, enjoy your day further.
Thank you.
Cheers for now. Bye.
Okay, bye-bye.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thank you to our sponsor, Go Hero Braces. Their sponsorship allows us to be able to give this podcast to you for free. So please go and check them out, goherogo.com. Don't forget also to bookmark the Vet Rehab Summit. It is on the Saturday, the 12th of November. Come and be a part of the world's largest online veterinary rehabilitation conference. It's created specifically for you, the vet rehabber community. Online Pet Health members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.